Next, I would like to introduce my dear friend and colleague, Emily Haddad, who's a licensed clinical social worker and a bioethicist specializing in behavioral health support and wellness for children and families with urogenital conditions such as bladder exstrophy. She has contributed to the development of multidisciplinary programs within the pediatric setting for this condition. Ms. Haddad is on the medical advisory board for ABC and has volunteered with the organization since 2016. She has volunteered her time in India during the annual bladder exstrophy workshop and co-founded the ABC initiative in Uganda. It is with great pleasure that I introduce my dear friend, Emily Haddad.
Hi, everybody. Nice to see you all. This is, I think, maybe the largest bladder exstrophy conference I've been to. And I'm very excited to see everybody in the room. All right, the green button is somewhere. Point at it. Okay. Okay, thank you. So I'm so excited to follow Kim, and then after me is going to be Jada. I'm very excited that both of them are involved in the programming today because we have so much to learn from them. I myself do not have bladder exstrophy. I just love and care about a lot of people who do. I was wondering if everybody in the room who loves or cares for someone with bladder exstrophy could raise their hands. Yes, so I think it's helpful for us to consider that we thrive best in community. So remembering that we're in good friendship here. So as Pam said, I'm a clinical social worker and bioethicist, been working on the medical advisory board as a volunteer. And I've also had the pleasure of attending the Youth Rally Summer Camp as a counselor. And I've had a great time with Jada and Jessica and Kate. And I'm excited for you to hear more about that camp today. This is just a picture of my little nephew, Mikey, for some levity. Okay. I want to also mention that I'm excited that Sick Kids is now a designated center. That's where I completed my internship and had a great experience there with Dr. Pippi Sally and his team. I worked there as a social worker under Barbara Nielsen. And what Barbara taught me was that people with bladder exstrophy, yes, indeed, have a lot of challenges. There's a lot of things that are very difficult. There's a lot of surgeries that they go through. But these are magnificent people who can really thrive. And it's not because they have a higher IQ. It's because they're creative, they're resilient, they're determined. And we learn that from the literature, and we see that anecdotally as well. So I want to think about today what the word thrive means. For those of you who are learning the English language in school, you have your dictionaries that you refer to. So I have the Merriam-Webster and the Oxford Learner's Dictionary here. So if we think about how what we think about when we think about thrive, we think about succeeding, being strong, being healthy. I want us to really consider number 2 here. So when we're thriving, we're progressing towards or realizing a goal despite of circumstances. But number 3, we're doing well in a situation or that's difficult, but not in spite of it, maybe because of it, right? So you're going to meet a lot of adults today who are thriving with bladder exstrophy in a way that maybe they wouldn't have the privilege and opportunity to thrive if they in fact didn't have bladder exstrophy. There's going to be people that you're going to meet today that you wouldn't have met if we didn't have bladder exstrophy. Also, of course, we want to highlight the importance of healthy thriving. So we want to ensure our kids, as we know with bladder exstrophy, have stable kidney and bladder health, that they can manage their stress, that they have positive coping skills, that they have the same ideas for themselves, and they know that they can reach the goals that they have in terms of academic, career, and family goals. And I want to talk about, too, the importance of thriving despite or because of the pain challenges that we experience with bladder exstrophy. I wish I could go back. Oh, I can. So one of the things that I often say to parents when I meet them for the first time when their child is born, it's a very shocking time. It's a stressful time. A lot of us didn't know bladder exstrophy existed until the child in front of us, who's ours, has bladder exstrophy. But one of the important reminders is that we are all going to grow because of the person with bladder exstrophy in ways that we wouldn't, and they're actually a gift. So yes, there's great challenges, but it's these challenges that we know lead to thriving. Okay, and then when we think about circumstances, you know, when you hear people talk in public health or in medicine, often we're talking about social determinants of health, and that can be all the things we don't have control over. So the community in which we're born, the clean water that's available to us, the employment security in the country in which we're living, our citizenship, all the things that aren't part of our personality, but are things that are out of our control when we're born. And then, of course, you know, unfortunately, some of us experience challenges such as trauma, family conflict, violence. The importance of articulating this is not out of fear. It's that what we know about the brain is that there's plasticity, and that if we experience trauma, we can actually evolve and transform from that. We're not traumatized forever. We actually can transform instead. So what does bladder exstrophy, what does thriving with bladder exstrophy look like? So here I have a few of my friends that I just wanted to point to. Thomas Vincent, unfortunately, isn't here today, but that's because he's hiking the Appalachian Trail. And he also just completed his PhD. So I think he's thriving and doing great. So even though we miss him, it's okay that he's not here. We also have Kim Allen, who you just heard from. She shared with you that her story was a bit different. She didn't know other people with bladder exstrophy until recently, but she thrived in her own way, and now is using altruism and philanthropy to help other people with bladder exstrophy. On the bottom left here, I have someone in a different stage of life. I have Zoe in Texas, who was born with cloacal exstrophy and has gone through many, many surgeries, but man, is she thriving. She's playing trumpet, she's in the school band, she's running, and she loves playing with her family's chickens. And then on the bottom here, I have Johnson, who's one of our good friends in Uganda, who's also made his way to India with Dr. Shukla's team. And Johnson has had many difficulties and many challenges, but he is really thriving. And he was thriving through the challenges as well. He's now progressing in school. He has a continent diversion, and he's the goalie on the soccer team, or for others in other parts of the world, the football team. So I wanted to mention the transitions through the developmental stages. We have people in the room here who are in infancy. We have people who are school-age children, adolescents, and adulthoods. The transitional path here is going to look different for each person depending on their personality, their family, their passions, their goals. But at each point, there's going to be different challenges that evolve the entire family. So I mentioned, you know, Zoe's initial birth and how her family has evolved a great deal from when she was born with cloacal exstrophy until now. We can think about the pivotal point of transitioning into the school setting, right? Where now we're learning how to care for our toileting in a social environment. And we want to talk about the importance of advocating for ourselves. We know that in the school setting, everybody has, every nation has a different, protections for people with disabilities that are either enforced or not enforced, but it's always important, depending on where you're living, to have a good understanding of what the rights are of your child or of you, and to keep track of those as they change and evolve. I want to speak about the importance of peer support in adolescence. We know that people when they're progressing through adolescence are not as interested in hanging out with their parents, not as interested in hanging out with their younger siblings, but they really are interested in hanging out with one another. And so the importance of fostering thriving while they're with their peers. And we can talk more about camp in that regard. And then, of course, we have adulthood and what we want to leave the world, what we want our legacy to be, what our purposes are, what our goals are. When we think about thriving and in terms of our psychological wellness and our mental health, we want to consider all the different psychosocial partners that we have involved in our life, right? So we have our formal partners who are part of the healthcare system. We have our surgeons, our nurses, our psychologists, the interpreters at the hospital, chaplaincy, child life. We have advanced practice providers, and then we have all of our informal partners. So this might be the school counselor, it might be a coach. Sometimes it's often a coach, right? It might be the soccer coach, the football coach, the theater coach, who's really supporting that individual in understanding what their strengths are and their goals are. And then importantly, as I keep mentioning, and I'm going to keep mentioning, is we have our camp counselors. So if we think about the formal psychosocial partners, they're often providing interventions. And one of the main highlights here is number one, which is the early integration and prevention. We've seen a lot in the literature and a lot in conversation. We've talked about bladder exstrophy as being a chronic illness that leads to risks of depression, anxiety, trauma. But again, we want to think about how we can prevent these things or how we can instill strengths and ways of coping with these challenges. So that's the early integration of a psychosocial partner that you're not introducing during crisis time, but from the very beginning. So when there is a challenge, the person is familiar. There's lots of formal behavioral health interventions I'm not going to go into, but of course we want these to be individualized and family-centered for your particular family. And there's lots of different modalities that are available that are not going to be right for each person, but for depending on that person's experience. Care coordination and case management can be provided by your social worker, but often this is completed by your parent. And we're going to talk about transitioning to adulthood and how the person with bladder exstrophy is to learn about how they coordinate their care. Oftentimes, it's also a social worker if you have available in your institution. I'm not going to spend too much time talking about school consultation today because it's summer, and I don't think a lot of people want to talk about school when they're out of it. But it is important, as I mentioned, to be aware of what the accommodations are available in your school. And from all the kids that I've worked with bladder exstrophy, everyone's school accommodations or school plan is going to be different. One of the main points that I think is important here is that your child is involved in those discussions. It's not the parent who decides, my child will use a private restroom or they will go to the nurse every day. It's going to be different for maybe the boy, maybe the girl, maybe depending on what their toileting plan is. Some kids want to go to the bathroom with all the other girls. They don't want to miss out on that time when people are hanging out. And so finding a way for them to maintain their privacy and integrity, but also be able to socialize and be involved with others. Other kids might want a private time in the nurse's station where they're getting medicine or they're accessing their supplies. And Kate, you're in this picture here, this camp picture. I chose it because you were in it. So I wanted to highlight a little bit about the importance of peer-to-peer support. So again, this can be formal or informal. But if we're thinking about thriving and progressing towards our goals, not necessarily despite of our circumstances, but because of our circumstances, I met people like Jada and Kate and different people at camp when they were much younger. I'm not that much older than them, but I am indeed older than them. And it's been really beautiful to see how they flourish, right? And it's not because of necessarily all the support that they gain from others, but it's also the support they're giving. And it's also the way for them to show, hey, yes, I'm going to India next year, or I'm traveling to Italy with my son and my husband. Like Jada. And yes, I have a pretty comprehensive and meticulous medical regimen. And yes, I'm still doing all those things. And so I think camp is a great opportunity for kids with bladder exstrophy to also meet others with urogenital conditions. So Youth Rally and Ostomy Canada Youth Camp are not just for people with bladder exstrophy, but for people with all different conditions. And my friend Erin Kavanaugh, who's not here today, met Barbara Nielsen, my mentor at Ostomy Canada Youth Camp. And she always says, Barb was really mean. I mean, she just made me do all my care. And it was just, she would not help me. And she was just so stern about it. But now I get it. Right? So Erin, who just defended her PhD dissertation in genomics and is moving to Germany, I think tomorrow, understands the reasoning for that stern direction, which is that we believe in you. We believe that you can do this and that you're capable. And no, you won't do it perfect at first, but you will do it your way. I also want to just mention all the importance of family support. One of the biggest lessons I learned from traveling with the team to India and being in Uganda is the amount of support that the families experience in the ward, right? Because they're not in private rooms, is immense, right? And I've also learned from families who come to these conferences that even if they don't talk to anyone, just knowing that there's other families, there's other people with bladder exstrophy, they're not the only ones, is vital. I'm really excited to hear about the patient advisory committees. And then, of course, as a social worker, I always encourage people to involve themselves in support groups if they find that helpful. And they don't have to be bladder exstrophy specific, but it's really important to know we're not the only ones. I want to point to just a few things that I think are valuable and important as we're thinking about transitioning to adulthood. My understanding is that Boston Children's has the Bridges Adult Transition Program, and I've spoken with your social worker, Christina Valerie, about this. They also have a social work transition committee. This is a really valuable resource for the local families here in the Boston area to gain support and guidance and how to transition into adult care. As I mentioned, I trained at Sick Kids Hospital in Toronto. Their system as a national healthcare system is quite different, right? So you transition at 18, but they also have a formal program at their institution. Every institution is different. They will have different models of transition, different resources. So important for each family to be aware of those. Kim talked about our adult patient advisory council, which is really exciting. And I also want to point people to gottransition.org, which is a great outline given all the different milestones and tasks that we want to complete as we age into adulthood. And here I just have a copy of what that transition timeline looks like. So this timeline and a lot of transition programs recommend that you start talking about transition to adulthood and adult care at age 12. I actually recommend you start it quite earlier. So you start talking to their kids about what their adult life can look like and understanding their goals at a very young age. Some parents might even start when their child is an infant and they're practicing talking about bladder exstrophy so that they can become more comfortable with the language. The infant's not going to remember what you said, but they are going to remember the attention, right? And then as the child ages, I think it's helpful to consider using the metaphor of getting a driver's license. So when we're learning how to drive, it doesn't just start when we're 15 or 16. It actually starts when we're sitting in the back seat and we're watching how our parents are driving. So we can think about how the child is joining their parents for their doctor's appointment and they're seeing how their parents ask questions, make sure that they understand what the reason is and the purposes of the different medical interventions. When they hear the parent advocating for their child, hey, I really need child life for this procedure, or hey, I'm wondering if they could meet another kid with bladder exstrophy. So the child is witnessing all that advocacy and they're learning. And then eventually the child starts engaging with the doctor themselves. And the parent is more in the passenger seat because the child has a permit and they're practicing with the parent there. They're gaining independence. And then eventually the child gets their driver's license and the parent is maybe sitting in the passenger seat scared, but they're watching and they're trying really hard to let go of power and control, right? Because it's really scary to transfer the medical care that you've worked so diligently to protect of your child to them. But eventually you notice and you observe, okay, they're fully capable. They learned all these lessons. They're learning how to fill their prescriptions. They're learning how to get their supplies. They're advocating for themselves in the school setting. They're advocating for themselves in the social setting when someone does something that they don't like or doesn't feel respectful. And eventually that parent gets to sit in the back seat and they get to take a nap. And the child is now managing their own health care because they've learned what they need and they've learned how to coordinate their care with their providers. So in conclusion, there's Zoe again with her pet chicken. People with bladder exstrophy will have a diverse experience. We know that from everyone's unique personality and everyone's unique goals and passions. What hospitals they go to, what surgeries they choose to have. Everyone will have a unique path. But more importantly, they can thrive no matter what their path is that they choose. They can grow and develop well. I have here despite their obstacles. But as you're going to hear from Jada next, I think you'll see that because of their obstacles, people with bladder exstrophy can thrive. Thank you.